I'm sharing the slides, or do you want to share them?
No, please do it.
Okay, I'll do it.
It will be quicker. I know we are running out of time, so.
But very interesting discussion. Thank you. Thank you for coming.
I'm sure, and I really apologize for arriving now at the end of it. So I'm really sorry. It was really impossible for me to postpone other commitment. So I hope I will not come kind of out of the blue, huh? And I will try to be, well, let's try it in 3-4 minutes. I have four basically verbs, and which are the roadmap for us as a commission, but with you, programs and the other services within the commission and the other stakeholders around us, where it basically guide our action in our daily action. So if we can go to the next slide, and basically the roadmap is learning, programming, embedding cooperation, and planning ahead. These are more or less what we are trying to do with all different type of action in different way. But learning, for what I just get now from the conversation, I think we are on the same. We have the same concern. I mean that really we are trying as a commission, as a DG Regio, but with our stakeholders to work a lot. Catriona is there. We have met during one of the study that the commission developed on patient mobility. This is an important one of them. There is the study that that Mercedes has presented on what has been done now by Interreg on healthcare in the Interreg program. There are many, in fact, now, because the topic is an interesting topic, in particular after COVID. And I would suggest to you as well, there is another study that has been done by Lamotte in relation to the impact of COVID with border closure and the impact of it in border area. I think it's very, very, very interesting. And somehow it, and I took one sentence from that study because I like it very much. It's a kind of mantra for us. And this sentence is there can be, and it was one of the conclusion of that study, there can be no emergency cooperation in the short term without well-established cross-border cooperation in the long term. This is really the key for us. And this is what, at the end of the day, most of the report ends up. We all need to really capitalize on what has been done. And this is my other point, just getting out of the perspective of the single project perspective to develop more strategic approach of the investment in healthcare. It's true in other sectors, but it's particularly true in healthcare, in order really to develop a more strategic approach linked to the territory, linked to the situation of the territory, and to, let's say, create more a more systemic multi-level governance approach in order to really englobe more than each individual single project, which are important, but we have many now all around, funded by Interreg or other frameworks. So I think it's really time to set up something that goes beyond that single perspective. Next slide, please. So what we are doing now this year in particular is going on with the programming of Interreg programs. There are 97 to be adopted this year. So we are working like hell to have them adopted, I must say. And we are, let's say, in good way for that. As you know, healthcare can be addressed in different way within the current, let's say, menu of policy objective. So of course there is a dedicated one that is 4.5 that you know, but there are other, because also the one in relation to innovation, because healthcare trigger a lot of innovation and really can be also a way to develop smart specialization strategy as well. And there are, this novelty is the PO5, the territorial, let's say, territorial strategy and territorial tool dimension, where there as well we support the development of multi-sectoral strategy. So, and it can be addressed there as well. And we know about some programs that do. in that way. And another very, very important specific objective for us is the one specific for Interreg in relation to better Interreg cooperation governance, the famous ISO 1, because it's precisely where there is also the possibility to make institutions, stakeholders work in a new way. Is where you can develop something in relation to data. We know that data is one of the main issues. We need evidence to develop adequate and targeted policy and investment. So it's important to develop that. And this is the place where we really invite programs. And the majority of the Interreg program have selected, was not an obligation, it was a strong suggestion, a word suggestion from our side, and the majority of programs have selected this specific objective. Now, based on my calculation, rough calculation, there are 27 programs that have selected 4.5, just to stay on those who are really sure to invest in healthcare in that way, which represent basically $500 million of total budget investment. So it's a relevant aspect, and it's not the only one. So we will see later on when we will have more information about all the program selected. Maybe there are others that also invest in other way, in some other, let's say, specific objective. Next slide, please. So the Interreg program are, of course, for us, the main way to develop investment in healthcare, but it's not the only one. We really insist a lot in the coordination between the Interreg programs, but the coordination as well with the mainstream program, because it's very, very important. Interreg cannot cover everything by definition, not because of the budget, of course, but not only. So there are different ways and complementary ways to approach those investments. So, and I'm sure you have mentioned all of that during the discussion beforehand. So this is really something that we care a lot in this programming period. We try really to do our best to promote this better coordination, better synergies with other programming framework. It's very important for us. And there are many ways to do this networking. This is one of the opportunity, for example, the Interact Inclusive Growth Network. It's very important, this type of activity for us. We insist a lot on also embedding cooperation in mainstream programs. So the other way around, let's say we would like the mainstream program to use much more the tool of cooperation. And now it's enshrined in the regulation. So we really are screening now mainstream program in order to be sure they also include a strand of cooperation that can be in any sector, of course. But so if you have ideas, you can knock the door of the managing authority of your mainstream program and propose something. If you have some important investment in healthcare, it's really a place where possibly you have also, let's say, larger possibility in terms of budget. And these are the regional operational program, and also the resilience and recovery facility. So there are also many other opportunities at national and regional level. I wanted also to mention that there is an increased attention on cooperation in healthcare, also at national level with bilateral agreements. So there is one that is going on between France and Spain. It started with the B-Solution. I think if there are Interreg people here, you know B-Solution. It's really a tool that we like a lot because it's simple tool providing, let's say, technical assistance and providing expertise to solve an administrative legal obstacle, basically. And we decided to go on with this tool because it's really very effective. So one of those solution that has been identified through this solution is becoming a bilateral agreement between two countries. And there is another one we are waiting because it's really has been announced, but it's undergoing. It's the new treaty of Quirinal between France and Italy. So this will include, it has been announced, a cross-border committee really dedicated to cross-border healthcare. So this means as well how important the topic has become since COVID. So we have to follow up this development, because sometimes it's really important also to have on board. We work mainly with regional and local authority, but healthcare is also national competence. So we absolutely need to have on board the national authorities. Next slide. So, and this is my hand, is basically what we are also working ahead. You know that we have published recently another communication in relation to border region as leading labs, because we know that how pioneer often border region are to develop tools and policies that then can be also mainstream. There are 4 strands basically we will work on in the future years. I outlined 2 of them in particular. One is really about institutional cooperation. All this work on obstacles, all this work on institutional and administrative capacity of bodies like EGTC. They're not the only one, but like EGTC. So all the work on data, development of specific data and comparable data in cross-border context. So this is really one of the aspects that we will invest a lot. I mentioned already B-Solution. It will be continued because it's really a good tool. And the other aspect we will work on a lot is the cross-border public service. There is an ongoing study now that is going to be, let's say, really published very soon, and that will be continued later on also with the European Parliament. We are working on that for the next 2-3 years. So cross-border public service, including that, of course, it's one of the big topics we are working on. So this implies as well a lot of more cooperation. That's what we try to do with the border focal point, also internally within the Commission, because we ask for coordination, cooperation, synergy to you programs, but we need to apply to ourselves. So I'm very happy to see Carmen, who I don't know, but we will meet later on, certainly. So in order, because we try for every new policy, for every specific funding framework, also to work internally in order to have the cross-border dimension taken into account and considered in any policy development produced by the Commission. Voila, that's all I wanted to say. I'm sorry for being late, and sorry for voila, last minute intervention. I hope it fits with what you have said. I'm quite sure it is, because for what I have just heard, I think it should be okay. So, and I will be glad to meet you again in person, and starting back with as we have done in the past, because I think it's important. We have some very good example of program that works with a very strategic approach in healthcare at territorial level. I'm thinking about, because we have done at some point Lower Austria in border with Czech Republic and with Slovakia. There are others. So I think this is very important to meet on site and to see how and what good things are going on. Voila.